What is PTSD? This is an overview for primary care clinicians to introduce them to this important disorder. PTSD, or post-traumatic stress disorder, is a chronic, complex mental disorder that can develop after an individual has been exposed to or experienced a major trauma or life-threatening event. Examples of these would include military combat, rape or sexual assault, and natural disasters. Trauma is a key part of the disorder. The traumas are either life-threatening or led to an actual or potentially serious injury. The response is also significant. The individual typically reacts to the trauma with intense fear, helplessness, or horror. Hallmark symptoms include marked physiological and physical symptoms such as anxiety, depression, cognitive problems, and often substance abuse. PTSD is also associated with social and family difficulties. PTSD is a relatively new disorder, but has gone by other names in the past, such as combat fatigue, shell shock, and soldier's heart. The symptoms of PTSD were described as early as the American Civil War. The term PTSD was added to the DSM-3 in 1980 as a result of increasing incidence of the disorder seen in Vietnam veterans. The lifetime prevalence of PTSD in the general population is estimated at 7 to 8%, with 10% of women and 5% of men developing the disorder at some point in their lives. PTSD can also develop at any age, from early childhood to late adulthood. An estimated 8% of Americans, or 24.4 million people, have PTSD at any given time. This is equivalent to the total population of the state of Texas. Nearly 1 million active duty service members have been diagnosed with at least one mental disorder since the year 2000. Between 2003 and 2011, the number diagnosed with PTSD increased by a factor of 6. 20% of service members deployed to either Iraq or Afghanistan had PTSD symptoms, yet only half have sought treatment. In primary care settings, where veterans seek medical care related to situations or experiences associated with PTSD, rates of PTSD are 2 to 3 times higher. Causes of PTSD in women: rape and sexual assault are the leading causes, with women being the largest group of PTSD sufferers. In men, violence and combat-related traumas are the leading causes. PTSD costs an estimated $10,000 per year for each soldier, or over $5 billion a year. The annual cost to society of annual anxiety disorders is estimated to be between $42 and $42.3 billion. This is often due to misdiagnosis and undertreatment. This figure includes medical treatment costs, indirect workplace costs, mortality costs, and the cost of medications. PTSD has a profound impact on patients, families, and society, and is associated with relationship difficulties, medical and psychiatric comorbidities, and school and vocational impairments. Patients with trauma experiences in PTSD are often reluctant to talk about their psychological symptoms and often present in a primary care setting with vague and persistent physical complaints. These issues frequently lead to non-compliance with medical treatments and recommendations. When should you suspect PTSD in your primary care setting? Whenever you have a patient that has any type of trauma history or any history of physiological or psychological problems, substance abuse, and unexplained medical symptoms. Why don't primary care clinicians inquire about PTSD? There are a number of barriers. Among them are an education deficit. Some primary care clinicians don't see violence as a medical issue. Time constraints are often a problem for busy clinicians. Clinician discomfort in addressing violence or psychological problems in general, misunderstanding patient needs, the stigma associated with this particular disorder, and lastly, clinician lack of awareness or limited knowledge of PTSD resources and the fact that there are effective treatments available. In summary, primary care clinicians need to be mindful of PTSD in their practices. Be alert to patients with histories of trauma, and don't be hesitant to ask questions. Provide a supportive and confidential environment to discuss these symptoms. And lastly, ask open-ended questions and don't hesitate to refer for further evaluation.